Hello, I am Dr. Manjiri Valsangkar, Director, Bhide Hospital Test Tube Baby Center, Pet, Pune. Today, let us see that if a patient has failed her IVF cycle once, when she is undergoing a second test tube baby cycle, what better or what additional technologies can be made use of to make the patient pregnant. Now, whenever we get patients with previous failed IVF cycles, we sit with the patient, take a detailed history, see whether we are finding a fault with the embryo factor or the mother's factor, which means either the embryo was a low grade embryo or the baby was not formed well, or the mother's endometrium, that is the inner lining of the uterus where the baby sticks to the uterus, seems problematic. So if we are suspecting the embryo factor, we evaluate the gametes, that is the eggs and the sperms individually to see whether there is any problem. We make a child if the previous embryo was a day 3 embryo. In the subsequent cycle, we usually go in for top quality blastocyst technology and for a frozen blastocyst embryo transfer, which will give a success rate of around 20% more than conventional technologies. If we are suspecting a problem with the endometrium of the mother, there are certain tests which can be done before we take up the second test tube baby cycle. First most is a 3D or a good 4D sonography scan, which will help us evaluate the endometrium well. Hysteroscopy, which is a surgery done under anesthesia, which will rule out any kind of abnormalities with the endometrium. It can be certain fibroids or it can be septum, polyps, or so on and so forth, and the necessary corrective measures can be done at the same seating during the hysteroscopy. And the third and the most recent technology which is available is a genetic test which is known as endometrial receptivity array or ERA testing, which evaluates around 298 genes which are responsible for implantation in humans. So all in all, the most important thing is, if you have failed your previous IVF cycles, don't lose hope. Talk to your doctor about the recent most technologies which are available, be positive and get the therapy done. Thank you.